Hello, everyone. My name is Maria Fontanilla, and I would like to talk about my project on nursing grade 12, in more particular, spironolactone as a potassium-sparing diuretic. Okay. Okay. All right. So the pharmacologic class of this particular medication is an aldosterone inhibitor. Like I said, it's a potassium-sparing diuretic, and it also helps with as an antihypertensive medication. Okay, so physiology of diseases. So basically, the indication for this particular medication is for edema associated with CHF, acute pulmonary edema, liver disease, renal disease, hypertension, and conditions that cause hyperkalemia. So there are a couple of things that are kind of linked together that I would like to talk about. Renal disease, hypertension, CHF, and pulmonary edema in my next couple of slides. So the first one talks about the chronic renal failure and hypertension. So a little bit of a brief pathophysiology of this disease is that we know that kidneys are highly vascularized, so therefore they has a very tiny blood vessels and inside are very sensitive. So therefore, if you have high blood pressure, it can cause for the filtration to be damaged, and of course, along with that, um, the tiny blood vessels will burst and be damaged as well, which in return, your filter will be damaged and will cause a proteinuria. As a matter of fact, proteinuria is a number one indication that something wrong with kidneys. So it is very important to for the blood pressure to definitely be controlled because hypertension is the number one cause of chronic renal failure. Congestive heart failure. So congestive heart failure, of course, the heart is not able to pump correctly, which of course can lead to edema and also, of course, pulmonary edema and peripheral edemas and everything. It is caused by a pressure and volume overload, and of course, if your heart is not working properly, there will be a great reduction in its contractility, and cardiac output will be affected by it as well. Preload or left atrial filling pressure is increased, resulting in pulmonary congestion and dyspnea. Although the systemic blood pressure is often reduced, there is an increase in systemic vascular resistance or the afterload, which can further reduce cardiac output. And of course, if there's a poor cardiac output, your heart is going to try to compensate for the oxygenation in the rest of the body. So a lot of times you would see a lot increased heart rate as part of a compensatory mechanism of the body. Okay. Overall therapeutic goals of the treatment is, of course, inhibit sodium reabsorption in the distal renal tubule, causing sodium and water loss. And what's really special about potassium sparing is that you hold on to potassium in comparison to, um, let's say, loop diuretics such as Lasix. You would lose a lot of potassium. In this case, you're trying to, it's holding on to potassium, and we obviously need that for our electrolyte imbalance. Of course, cultural considerations and potential herbal/alternative therapy. One thing that I found is, peas with a lot of potassium in it. For example, black peas have 22 grams of potassium. green tea has 17 grams of potassium. Herbal brews have 21 grams of potassium. So if you're taking um, a lot of, let's say you're taking a fairly good amount of spironolactone in general, and you're in the culture or you're in the habit of drinking black teas, green teas, and herbal brews, or just have um, in your diet with a lot of potassium in it, such as the minions, of course, you're very prone for having hyperkalemia. So education needs to be provided for these patients, and of course, we want to assess their um, their daily diet as well, so you can provide them education regarding hyperkalemia, and we will talk about the signs and symptoms of hyperkalemia, so therefore they will be aware of it as well. So current research, I read the article called Spironolactone Prevents Chronic Kidney Disease Caused by Ischemic Acute Injury. So for example, in this particular article, um, they were studying, of course, rats and their kidneys, and they had an induced ischemia on their kidneys. After 24 hours, the rats that did not have spironolactone, they went from acute kidney injury to chronic kidney disease or chronic renal failure after just 24 hours. But the rats that have spironolactone in it, it showed that they have a lower uh, protein urea in comparison to rats that did not have spironolactone. As a matter of fact, um, it's a 50% lower uh, proteinuria in comparison to rats that did not get treated with spironolactone. And also, after about 10 days um, of going through the ischemia, they found out that rats with spironolactone had normal renal blood flow as well as normal serum creatinine level and creatinine clearance. Also, in the study, they found out that in between uh, 0 to 1.5 hours with the low dose, they're able to reduce the tubulointerstitial fibrosis to 14.8 and 15.1. So there is a pretty significant um, changes, positive changes. And also with the high dose, they're able to affect the tubulointerstitial fibrosis and in the reduction of further damage, at least by 11.8 and 7.8. And for my best practice, I found an article called Spironolactone Therapy is associated with reduced ventricular tachycardia rate in patients with cardiomyopathy. So we already talked about how patients with CHF have um, a compensatory mechanism that's activated, of course, and by increasing the heart rate because of the low cardiac output, right? So when in the study, when they use spironolactone uh, as an adjunct to statins or ACE inhibitors, they're able to decrease the ventricular tachycardia. For example, patients with spironolactone, their beats per minute is 158 plus or minus 26 beats per minute. But patients who did not receive spironolactone as an adjunct to their statins or ACE inhibitors, their heart rate is in about 205 to 22 beats per minute. And so that's significant. There's a significant difference there. And also, it reported that there's beneficial effects on left ventricular remodeling and diastolic function. So overall, it just helps the heart. And also there is a reduction in sudden cardiac death rates documented with use of these therapies. Of course, while the patient is on spironolactone, you want to monitor signs and symptoms of hyperkalemia, which we'll talk about in a little bit. Of course, you want to advise them to follow up with their medical doctor, get their labs done. Um, Also advise the patient to restrict intake of high potassium foods and to avoid lactose, which is salt substitutes containing potassium. And you might want to let them know that it may cause breast enlargement. So if you have a patient that is a male and taking spironolactone or any potassium-sparing diuretic, you want to let them know that they might be at risk for gynecomastia. And this is my Python chart, which I will show in a little bit. And these are my references. And let me show you my Python chart really quick. Hold on. Okay, so this is my Python chart. And I talked about the indications for this medication, of course, such as edema caused by heart failure, hepatic cirrhosis or hepatic syndrome. I talked about the actions such as inhibit aldosterone effects in distal renal tubule and promoting sodium and water excretion, potassium and retention. Pharmacologic class, aldosterone inhibitor is a pregnancy risk category. So the side effects, this is very important. Agranulocytosis, metabolic acidosis, and of course, especially hyperkalemia because they are holding on to potassium. And I'm going to talk about the drug and food herbal interactions. So I included the drug herbal interactions such as locarice, and of course the green tea, the black teas, and yeah, a drug food potassium containing salt and substitutes increase risk of hyperkalemia, which I talked about earlier. And as far as drug and drug interaction, I think it's very important to talk about uh, salicylates because that can decrease the diuretic effect, and that's over the counter. So if you have patients that are taking this on a daily basis, you want to let them know that it can increase the diuretic effect, and of course you want to communicate that with the physician as well, so they can maybe adjust the dose or the timing of the medication, etc. And also, if you have a patient who has the digoxin or taking the digoxin, uh, you want to be really aware that it can increase the digoxin level. So you want to watch out for signs and symptoms of digoxin toxicity. And of course, if a patient is taking anticoagulants, such as heparin, it will reduce the uh, hypoprothrombinemic effects of these drugs. Okay. Ameliorating factors. I found quite a few things. For example, it improves the lipid metabolism as well as glucose metabolism. And another one is the ameliorating hepatic steatosis and inflammation, and suppressing enhances gluconeogenesis as well in high fructose diet. And administration is usually given by mouth, and these are different dosages that is taken depending on the indication. And of course, you want to be extra careful if it's being used with neonates as well as children because they go by weight, of course. In my follow-up indication, of course, follow up with your potassium follow up with your potassium level and signs and symptoms of hyperkalemia such as muscle weakness, muscle aches, muscle cramps, self palpitations. And I also included my patient teaching at the bottom in my picture. And that would be all for my presentation. Thank you so much. I hope that you learned quite a few things about spironolactone and potassium sparing diuretics. And I can't wait to actually watch other people's presentation and learn from them as well. Thank you so much. Have a good day.